YouTube. Just 1 second here.
Okay, it shows me as we are now streaming live. Thank you, Steve. Good morning to everybody. Good morning, San Ramon. It's Friday. We're doing a live Zoom broadcast, our second in the Mayor's Breakfast. We have, I think, a great panel of guests this morning. And if they could, and this is not all of them, some will be dropping in during the broadcast and having to step out to their jobs. And so I appreciate those who will be here during the broadcast and who will be coming and going. We plan on doing these broadcasts every Friday morning. It'll be live for those who want to jump on at 9, but we're also recording this and it's being posted on the city's COVID-19 website for those who want to watch it later on. I think, Steve, our numbers are up almost to 1,000 in terms of total views, both live and later on. We'll probably end this sometime after 10, maybe 10:10, depends upon the number of questions we have. I don't want to rush speakers. We've got a good series of speakers to update our community today, so I don't want to rush it. People can make their points. After the speakers are all done, we will be going to questions. And Steve will be quarterbacking that. Steve, raise your hand for a second. So Steve will be the one who'll be asking questions. To submit a question, send them to info@sanramon.ca.gov. And then Steve can gather the questions and ask them. He already has received a bunch already. If you have questions to submit to us after the broadcast, that's great, because the more we get these questions, the better able we're to get speakers who can address these questions that we have in our community. And I'd like to introduce our speakers today. We're going to kick it off with Joe Gorton, our city manager, and he'll be making some comments. Next will be Rick Schmitt, who is our superintendent of schools. Rick, kind of raise your hand so we know which one that is. With Rick talking today will be school board member Rachel Hurd and school board member Ken Mintz. After they're done, State Senator Steve Glazer will be talking, and Steve will be jumping on here momentarily. After Steve is done, our county supervisor, Candace Andersen, she'll be talking to us and updating us because county has been the lead agency on this. And after her, we're going to have Ann Lucena from the CEO of the San Ramon Regional Hospital and a special guest, Dr. Patrick Joseph. He is an associate professor at UCSF, and he's also the past president of the National Foundation for Infectious Diseases. And Dr. Joseph, we appreciate you being here during the broadcast and to give us some of your insights. And I know our residents have lots of questions about what things they can do outdoors that are safe, and masks and other kinds of issues. After they're done, we're going to go to questions. So with no further ado, I'm going to introduce Joe Gorton to give us a quick update from the city's perspective. Joe.
Thank you, Mr. Mayor. Welcome, everybody. I don't want to take a whole lot of time because we have some important information that we want to put out there. So I would just reiterate that the city is open for business on a limited capacity, but every number to all the major departments will be answered. So if you have specific questions, there'll be a live body to answer questions and help you out. And all of our information can be found at our website, at the city's main website. And I'd like to hand that over to Steven Spadowski, the Deputy City Manager, to give you a quick run through on the website, and it would allow you to hopefully answer the majority of your questions. And if there are any other questions, or if you need any other help that the website can't provide, we're here to help you. So I'll hand it over to Steven, and then Mr. Mayor, you can take it away with the guests.
Thank you.
All right, thank you, Joe. I'm going to share my screen here so you can see exactly where the City of San Ramon COVID webpage is. So if you go to the city's homepage, we have a banner here that says click for COVID-19 updates. And we're putting all of the information that we come across on this website. So we have, I'm not going to go through the whole thing. Each week, I've been highlighting one area or another. Last week, I did show the local takeout for all of the restaurants that are still open. And this week, I want to make sure that everybody knows our hotline page underneath here for COVID-19 hotline. We have a general hotline, a hotline specifically for seniors, and we also have one in Mandarin right now, and then the number for general questions. So everything that you need is on the COVID-19 page. If you scroll down here on the left, we also added links to the mayor's virtual breakfasts. We now have also a virtual police department and video messages. So let me stop sharing here. Once again, you can email any of your questions at any time. We're answering them 7 days a week at info@sanramon.ca.gov.
Great. Thank you, Steve. I'd like to introduce our superintendent of schools, Rick Schmitt. Rick, I know that these have been really challenging times for education throughout the state. I think from my perception, you guys are doing a great job in keeping residents informed of what you're doing. And I think next week you're going to be going what's referred to as distance learning, and you've been doing a lot of work to get ready. So Rick, go right ahead. Rick, you're on mute. Rick, you're on mute. Ken, do you want to jump in there, or Rachel?
I'm not sure what. Good, Rachel.
Well, actually, the remote learning started a little sooner.
Sorry, I was
There you
had a little
go.
technical
There it goes.
glitch there. Thank you. Sorry for that. Again, Bill, thank you as always for including the schools and everything you do and all the support. And look forward to a brief update and then some questions to follow. So 90+% of school districts in the United States are working on remote learning and trying to put together opportunities for kids in an unprecedented way. We've sent 24+ communications to our community, trying to keep them updated. Like the city, I think we have a very vibrant and updated multiple times a day website for folks to get their questions answered via email. We've made hundreds of phone calls. We've tried to stay in front of this as best we can. I'd like to give a shout out and a gigantic thank you to our staff, to our parents, to our kids, to our partners in the community. These are difficult times, and each day is different than the day before, and we're trying to work together. Very briefly, our remote learning package is meant to be aligned with the state standards, give students new opportunities beginning next week after spring break to prepare them for the next course in middle school and high school, and in the elementary grades, prepare them to promote to the next grade. That doesn't mean that we're not going to have to do some special things in the fall if we are lucky enough to get back to classes in the fall to do some review. We are planning on, within the next month, updating our community on what we're going to look like during the summer and what type of programs, if any, we will be able to provide our families. Nearly every decision, even though locally our trustees have supported those decisions, come from either the state of California in terms of distance learning, what we're calling remote learning, and in terms of when we can actually access our buildings. Those decisions are made by public health, both statewide and regionally. One of the two primary areas of question and concern, and we fully understand why, are around grading at the high school level and how we best take care of all students and each student to prepare them for what's next after high school. And we believe we're aligned with other high-performing districts in the state of California, including places like Acalanes, Palo Alto, to name two. The other piece in regards to how we best support kids, especially our high school students, is what are we going to do to help our seniors especially, but 8th graders as well, since it's very unlikely that there will be traditional promotion and graduation opportunities in person. And we will look for creative ways to celebrate our kids next month, as the traditional last day of school is May 29th. So a very, very brief overview. And again, I think I may be able to help out with some questions later. I don't know if Rachel and Ken have anything they'd like to add.
Thanks, Rick. I would just add one thing, and that is how we got to this point. I know a lot of people had questions about when we were first starting out. Initially, we kept our schools open. And as Rick said, a lot of the decisions we were making were based upon direction from the health department, the county, and the state, even the federal government. And initially, the thought was really about schools were the safest place for our kids to be. And as situations changed, that's when we pivoted to our first part of our plan, which was to re-engage our students and our teachers, but do so in a coordinated fashion that initially it was about getting everyone comfortable in the situation. So we took a pause that first week. Once we started getting into our first phase of remote learning, it was about review, opportunity for people to get used to distance learning, using technologies for our special needs students, getting them packets of information that even our school bus drivers help to deliver. And we're in spring break right now. Next week, as we move into remote learning at the next phase, which is new learning and creating an environment that we can use going forward. Because we don't really know how long this is going to go, but we want to make sure that we create a stable, consistent environment for our students as quickly as we can. As far as the one other thing I'd like to say about this, you may have heard of other districts and school programs that jumped right in and did not take that kind of pause. And they found that they kind of missed out because of the need for getting structure in place first, as we did, actually created a more consistent, smoother process for families and kids. And I'd just like to say, though, we're very, very open to people's feedback because we are building this as we go. And we really want to do what's best for our family and our
Rachel.
kids. Thank
I
you.
think both Rick and Ken really covered it well. I'd like to magnify one point that Rick made, and that is that as we go into the next phase of remote learning, which does include new learning, it's not just traditional go to school, sit in front of a computer for 6 hours. The focus is on essential standards so that kids can move on to the next course. And I think that distinction is really important for folks to understand. And the grading piece fits into that as well. So our Ed Services team has been very thoughtful with all of this and has done a lot of benchmarking with districts throughout the state. Rick named 2 of them, but another one that people might be familiar with, it's a community in Southern California. Irvine is very similar to us too. And so there's a coordinated effort on all of this that is aligned with what universities are asking for too. So I hope our kids, like Ken said, we're glad to hear from them, but I also hope that they can find some comfort in that a lot of the what ifs they're thinking of have been thought through.
Great. Rick, I know you have to depart here pretty soon or before we get to the question part, and not that you need to respond to this question here, but one of the things I'm hearing from residents is for seniors, not going to have senior ball this year. Graduation, in terms of how it's going to be celebrated, is still perhaps up in the air. Community members are thinking of different ways, from signs and yards to other ways to recognize these seniors, because they only get a chance to graduate as a senior once. So something that, if not here, that we can begin to give some feedback to residents, at least from the city's perspective, and how we can partner with you to help these seniors celebrate this special year for them.
Yeah. So I don't mind fielding the question if I have a minute. Is that okay, Bill?
Yeah, we have at least 4 more minutes before the senator comes on.
Okay, so we have been communicating for a month or so with, again, a group of districts in this region who look a lot like us: Pleasanton, Castro Valley, Acalanes, Palo Alto, Boscata, Saratoga. And we're brainstorming and looking at best practice on how to celebrate and honor our kids, especially high school kids, but also 8th graders promoting. We're not sure
Right.
what that will look like yet. We've done some work, but we need to engage our high school kids and our parents. One of the things that will be scheduled, not next week, but the week of April 20th, is we're going to do some town hall style sessions with high school kids and parents to ask them for some ideas. We've got a website that is all about our remote learning and all of the other kind of challenges we're facing because of the no in-person learning. And so we've already received a number of really nice suggestions from kids and parents. So we will communicate, we'll listen, and hopefully by early May, we'll have something out there and how we'll do it and what we'll do. And as always, our partners, the city, the town, the county, PTA Ed Fund, I'm sure they'll partner with us and look for creative ways to celebrate our kids.
Steve, I mean, Rick, I really appreciate that. And to Rachel and to Ken, the whole community really appreciates the long, long hours you guys are all putting in for our 31,000 students and allowing them to continue to have an educational experience in these really trying times. And I hear from people all the time complimenting both the school board members and what you're doing, and also Rick, your entire staff. You guys are doing a great job. Thank you.
Thank you, Bill.
Thank you.
We have coming on board now our next guest, Senator Steve Glazer. Steve, welcome. The state, I know, and you have been really, really busy with all of the COVID virus news. And I know the county's been on the front lines, but Steve, you and the governor of our state have been very active. So I want to give you a chance and opportunity over the next 10 minutes or so or more. Share with us, what are things you think residents of San Ramon should know about what's going on?
Thank you, Mayor. Can you hear me?
We can hear you.
Okay. Well, thank you for the opportunity to talk. I can give you a few minutes of overview, but I really would like to take questions and be responsive to topics that you and others may have. Obviously, this is a very difficult circumstance for everybody, and something we've never experienced in our lives. So, you know, everybody's struggling, and I know your constituents are, and everybody on this call who has leadership responsibilities, and those who are able to still work, plus kids at home. I mean, it's just a lot. And I'm sensitive to everyone's difficult circumstances. We try to find our way through this. I have tried, you know, we all have, what role can we play in this crisis? How can we be helpful to people? There's the state level leadership led by our governor and what he is doing, and how we in the Senate can be supportive of those important activities. And then there's the district, our Senate district, 1 million people, and what can I do to help people get through this? So I have, as you are doing with the Zoom and conference call, using technology to connect with people, I've tried to do the same. I've had 10 town halls, telephone town halls, web town halls, with experts in various subject areas to try to help people in areas in which they have concern or sensitivity. We've done 2 on the grocery supply chain, and is there scarcity, is there not? Brought in executives from a lot of the pharmacy and grocery chains to talk about that. There's good news there. This week, they expect to be up to about 85–90% back in the full supply chain in our stores. Hopefully people who are trying to shop for things that are necessary are able to find the things that they want. And also making sure that they're implementing the physical distancing requirements, the healthcare requirements to keep us all safe, whether that's checking their temperatures for their employees, having them fill out questionnaires about their health before they begin, having them wear gloves and masks, that they're all working to adapt to our county health requirements. And it's not just in the marketplace, it's all the way down through the supply chain. And so we've been getting updates on that. We've had sessions about small businesses that have been forced to close, their availability of loans and grants through state and federal programs. We've had our session just yesterday on unemployment and how people who are unemployed, and we've had 2.4 million Californians apply for unemployment insurance in the last 3 weeks. It's a massive influx in our system that they're still rushing to try to adjust to. We did a program on mental health and how we can cope better. We did one on animals and how can animals transmit COVID-19, and how can we make sure that we're taking care of our animals in this situation. So all these webinars and town halls are all on my website for you and others to find things that you're concerned with, and hopefully find some answers from people who know a lot more than me about all these subject areas. So that's been kind of the role that I've tried to play and my staff has tried to play, to stay in touch with city managers and elected leaders and school board officials who I know were just on just a moment ago, to deal with this massive disruption that's going to be with us, unfortunately, for a little while longer.
Steve, you did answer one of the questions that I've been hearing around the supply chain and the stores, and you gave a quick summary of 85 to 90% back. Is that what you've heard this last week? And can you give us a little more details? People are concerned about accessing supplies, not just today, but the next couple of weeks.
Yeah, so we had the regional president from Safeway Albertsons on late last week, and he said that at the peak of this, and when we were starting to go into shutdown, there was obviously a run on groceries, and it brought their inventory down very, very low. I think he said in the neighborhood of 30 to 40%. And they've been working with their suppliers to bring that back up. And so he said that this week at his marketplace, that they've been able to get it back up to close to 90% of inventory when you go to the market. Now, does that mean everything is there? No. Obviously, there's still issues with sanitizers. There's still issues with toilet paper. Yeah, there's still, in narrow bands,
Right.
challenges to catch up. But for the most part, when you're going to the grocery store today, you should be able to find most of what you want.
That's a real testament to their supply chain because, and this is a point about not just our first responders, but I think we have heroes throughout our community. Everybody who's involved in continuing the supply chain, making deliveries, all those folks who are still working and making sure that we get fed is really important. And sometime I think we should be recognizing those individuals, especially grocery clerks who sit in those checkout lines day after day. They're really amazing people. So thank you.
Well, and Mayor, the supply chain, we don't really talk much about it, but it even begins in the fields with our farm workers, many of whom don't have the health insurance coverage and so are much more stressed and vulnerable that if you can't harvest those crops, nothing gets to the marketplace. And we enjoy in California so much fresh fruits and vegetables, we take it for granted, but those things don't get picked automatically. There are a lot of people out there in the packing houses on the fields trying to bring them in. But at the same time, the agricultural community is suffering greatly too. We've talked about all the different segments of our society and who is more challenged than others. With the restaurants shutting down and international shipments being blocked or delayed or prevented, there's a lot of pain in the fields for the growers that we haven't begun to even talk about. And farmers market has been an outlet for many of them. And while they're allowed, I believe, I see Supervisor Andersen's on the call too, they're allowed, they have to practice the same social distancing, physical distancing requirements that everybody else has to do. And that's difficult in an open space. So I don't even know how many farmers markets are still active in the area. But that is a great place for people to get fresh fruits and vegetables directly from the farms, yet they're also impacted.
Great. Senator, any other comments? Because I know you have a very busy day. And anybody have any questions on the group here for the state senator? Not seeing one. Steve, we do have some questions that we usually save to the end. I'll make an exception because I know you have to leave. Steve, there was perhaps one question to address to the senator.
Sure, we did receive one question, and it's how do you ensure through legislation that California has the proper amount of ventilators and medical supplies for a pandemic outbreak going forward?
Well, it's such a good question and an important question. And linked to that question is this ability to bend the curve, to flatten the curve of exposure and hospitalizations. And then in the worst case, in an ICU unit, the need for a ventilator so that, because your lungs are failing. So the governor has laid out goals and expectations for the state and what he expects to be able to have on hand to deal with the rising caseload. And we have over 10,000 ventilators now in the state. He has goals of trying to get an additional 10 to 15,000 more ventilators in the state. He has his own modeling that he's using to look at the curve of exposure and hospitalizations and the need for ventilators. His modeling shows that that's peaking in the middle of May. Now, there are other models that show that happening much sooner than that in April. But according to his administration, based on his modeling, he is trying to acquire the ventilators that can allow us to meet that peak demand. Now, he made a decision earlier this week to share 500 ventilators, California ventilators, with other states. And he, as we in the legislature have asked him for some, and our role in these circumstances is oversight, is to make it, is to require him to provide some explanation, detailed explanation of exactly what he is doing and why. But he feels that because the peak is hitting in other states more quickly, and that our California stay-at-home requirements are starting to bend that curve, that he feels that he can allow that shipment to occur with the assurance, according to him, that those ventilators can come back as we get closer to need, as he projects at a peak in May. All these things are subject to change, but at least at this point in time, he is assuring us that we have the ventilators that we need in our emergency rooms in the coming weeks.
Great. Senator, I really want to thank you for taking time out of your busy day to address the residents of San Ramon. And I know that your office is always open to us when we have questions. So thank you very much.
All right, thank you all.
You're welcome to stay, but I know that you have a busy schedule. So thank you, sir.
Thank you, Mayor.
Thank you. The organization, the agency that's taking the real lead have been the counties. And the counties have been the forefront, both of reporting information out, but also managing a lot of the process that comes down from the state, from the feds. Candace, we appreciate how you guys have been keeping us informed, and tell us over the last 7 days, what are some important information our residents should know that's going on?
Absolutely. So over last weekend, we did update our county website, our dashboard, to include a city-by-city breakdown. And that was really something that the public had requested. We were able to do that. And what's important to note is this is just one measure of statistics. Because we don't have enough testing in the state of California, we are assuming that there may be 5 to 10 more people than is actually being reported. And so when you look at the numbers right now, San Ramon is showing that you have 26 cases. And when you equalize that for population, it comes out to 35 cases per 100,000. Now, in comparison, Danville has 20 cases, which is 6 less than you, but that comes out with their population to 46 per 100,000. So again, and there's some communities that have a higher amount. Orinda, for example, is much higher because of an outbreak in their care center. We are now starting to collect race and ethnic data. We're not getting a complete picture yet because hospitals, testing centers report it, and about 1/3 of them have not yet reported that to us. And so we're waiting until we have a complete data set to really be able to provide that information as well. Something new this week is we really want you wearing a mask of some kind anytime you are out in public. And we don't want you using, the N95 mask or even a surgical mask. A bandana works. There are some wonderful tutorials on YouTube of not only how to sew them, but how to put them together, even if you don't have a sewing machine or sewing skills. So not when you're just on a walk with your family, but when you're out anywhere where you'll be interacting with people, please have some kind of a face covering over you. We want to ensure even at our grocery stores, our workers, that they also have those. Most stores are complying with that, but it's very important that you do that. Other order that came out this week is if you do test positive, we're not just advising you to stay home, we are mandating that you do so. You must self-quarantine. You must advise people who you have interacted with in the previous 2 weeks of your condition as well. Easter Sunday is coming up, and we know people want to gather as families, do things. Resist that urge. Don't start mixing households, and be very, very cautious in your recreational activities. East Bay Regional Park District has some of their parks and trails open, but they are closing their parking lots because they don't want you congesting onto a trail or in a parking lot interacting. Try to do those hiking adventures in your own backyard, so to speak, in some place that you can walk to, some place where you can maintain your safe social distancing. Senator Glazer mentioned farmers markets. In fact, Danville is opening their farmers market this Saturday, and they are going to be following some very strict requirements of social distancing, of not allowing you to sample foods, not allowing anything but essential foods, and you're not allowed to touch the produce. It's once you have it, it's yours. So, it's an interesting, I had a conversation with a neighbor last night, and she was saying, I feel a little bit better about a farmer's market because I know it's just pretty much the farmer and his workers who have touched the produce. It hasn't gone down that supply chain. So anyway, if you go to a farmer's market such as Danville's, by all means, please exercise caution. Got to have a mask on. Ideally, you've got gloves on as well. Other thing we're doing this week is our homeless population. We have homeless shelters in Contra Costa. Right now, we are relocating those clients into hotels where they are supervised and they have assisted care through those. Places like Shelter Inc., some of our partners are managing those contracts. We want to clear out our shelters. We're doing a deep cleaning of them this weekend. They're going to be an alternate care facility as more people come down with the COVID-19. Our modeling right now is still pushing within Contra Costa to see a surge right at the end of April. Early May is what we're looking at. Historically, we hadn't seen an increase in 911 calls, visits to our emergency department, but we are seeing a little bit of an uptick. And right now we do, of our current patients in the county, we've got 484 cases. We anticipate reaching 500 this weekend. 75 of those are hospitalized. 27 of those are in ICU beds. Countywide, with all of our hospitals, we have 75 ICU beds. Now, all of our hospitals are trying to gear up and create additional potential ICU level of care, but it's disconcerting when we're very close to half of our ICU beds being occupied by COVID-19 patients. That doesn't include the stroke patients, the heart attacks, others that also need to utilize those beds. And so our hospitals, working in concert with the county, are doing a great job of gearing that up. We do have Craneway Pavilion this week, which has up to 250 additional beds. We as an alternative care facility, we're no longer looking at Alhambra High School or the Pittsburgh Health Center, but we are looking in negotiations right now with an unoccupied office building in Concord, and that's going to potentially be another alternative care site. If you are seeing any fraud, DA's office has updated its fraud line for COVID-19 related consumer issues. That number is 925-957-8708. And you can also go to DA-report-fraud at contracostada.org. We have been reducing our jail population. I know last night we had a high-speed chase that went from Danville, picked up by an ALPR, an automatic license plate reader camera, picked up by wonderful San Ramon PD. And the individual who was in a stolen car escaped, took off. Your great canine unit captured the individual. He was arrested. He was taken to Martinez for booking. He was declined. Now, the reason he is that the state has come out with very strict guidelines about who we can book in our county jail. And with our Judge O'Malley, not Nancy O'Malley, the DA in Alameda, but Judge O'Malley, who sits on our bench, she set up guidelines. And because he was not a violent offender, because he did not seem to pose a great danger to the community, he was instead cited, given it's still charged with a felony, but cited and released. And I know that has some of the community concerned. And Sheriff Livingston is working very hard with our district attorney, with our public defender, to make sure that those who are in the jail are those who really pose a danger to the community. And we do not want to see a significant outbreak. We are continuing to do testing there and in other congregate care facilities. And that takes them to the Rinda Care facility that you may have heard about this week, where we've had 28 patients, 23 staff who have tested positive. 4 of those patients are currently in the hospital. And we did finally, our health services early last week requested an investigation by the state regulatory agency, because we were very concerned about that facility's ability to really care for the patients that are still there. We wanted to keep those patients there because it is a skilled nursing facility and we don't have a lot of beds. elsewhere. And so the state is coming in, they're doing an assessment, they're going to provide some backup support to those services. Now, in contrast, in Pleasant Hill, the Carlton Senior Living Facility, we've had 5 patients tested positive there, but because they live in individual apartments, it has not been as serious an issue to be able to treat and isolate those as well. But 11 of those care providers also have tested positive. And so then we're looking forward to when can we really start planning for recovery? That's on all of our minds. We've got to get this economic benefit. How are we going to recover from this crisis? And we're not there yet. We really, really are right now mostly concerned about keeping all of you safe. We are flattening the curve. We are bending the curve, but we're going to need to continue to do that for the next several weeks before we can really start planning for how can we bring people back online? How can we start going back to our daily lives? So still a lot unknown, and I'm going to put a plug. Any of you who are concerned about this, and call 211. That is our crisis center in Contra Costa. We contract with them. The Contra Costa Crisis Center, they have wonderful people there to sort of help people talk through issues, or if there are things that you need, they're there to help as well. So that's my wrap, and thanks for inviting me again, Bill.
Thank you, Candace. We really appreciate you giving us from the front lines what's going on. Speaking of the front lines, there are the hospitals. And Lucia is here, CEO of San Ramon Regional Hospital, and you were here last week and gave us brought us up to speed. Over the last 7 days, what do you see happening and how is the hospital doing?
Thank you, Mayor Clarkson. I will try not to repeat myself from last week, and I'll be brief. I want to make sure my time goes to Dr. Pat Joseph, who is a wonderful member of our medical staff and a preeminent expert in this field. So I certainly can't speak on his behalf, but I'll give a couple of updates. And I also want to say thank you again to everybody on this call who's been a leader and a great partner in doing all of this so far. It's been really great to work together, and I'm really grateful for everyone's support of the hospital. I do also want to recommend using the coronavirus.cchealth.org website with the new dashboard. It has been really expanded. Thank you for providing all that extra information. I know a lot of people are asking about how many cases or what the demographic breakdown is. It has it by gender, by age, as well as by location. And I think that's very helpful. I also want to point out that where it shows the number of total positive cases, it includes recoveries. And so I know we're very focused on the sickest people, but we also have some great stories of people who are recovering from this and are coming out on the other side. And so that is a cause for hope and a little bit of optimism given all the scary news that's coming out. So as we've talked about on the last call, there was a recent outbreak at Orinda and Pleasant Hill. In response to that, our hospital and all the hospitals in our area are coming together to try to provide more resources to those skilled nursing facilities. So we're trying to be proactive about getting them resources so that they can prevent future outbreaks and then hopefully avoid needing hospitalization for any patients there, because we'll prevent the outbreak in the first place. So this week we sent our chief nursing officer, our infection control director, and our director of emergency management to several facilities in our area of San Ramon and Danville to have to provide some consultation, training, offer resources, specifically in the areas of infection control, so that they are more well equipped to handle the potential for an outbreak and hopefully prevent it from happening in the first place. We still are happy to report we have capacity in our ICU and in our hospital beds. We took a lot of steps to make capacity, including by postponing a lot of our elective cases and closing a lot of our outpatient services. So we still have capacity in the hospital. We also think that the shelter in place, which was really wise to do early, really led to fewer visits to our emergency room in the first place. So that's led to fewer inpatient stays. And so we have the capacity for patients should a surge occur. We still have adequate supplies of personal protective equipment for all of our staff and our physicians. We are embracing the universal masking approach that Supervisor Andersen referenced. And so we definitely encourage everyone in the community to also be masking. Doesn't have to be a medical grade mask to be effective in the community. In the hospital, obviously, we're using medical grade masks. I would just also emphasize that we're ready in case a surge happens. We still have an ability to expand at San Ramon Regional. Fortunately, we haven't come to that place yet, or haven't come to that point, which is great. And we hope we won't get there, but we're ready if we do. We also have a number of nurses, doctors, volunteers, and other staff who are able and ready to step up and help and handle if we have a surge. I I saw that one of the questions was about using school nurses and other nurses in the community. We really appreciate that. We've had a lot of people reaching out, offering their services. Right now, we're able to handle our patient load with the resources we have and the staff we have currently, but it's good to know that there's so many people out there who are willing to help in those situations, and we will definitely reach out if we get to that point. I'm glad that we're not there yet. And last thing I'll just mention is that we continue to follow CDC, CDPH, county health guidelines. So if you're unsure about what you should be doing, those are all really great resources for all of you to look at. I did want to address one other question that came in is about testing. So we are working on standing up outpatient testing capabilities for COVID-19. It's not operational yet, but we will be working on it hopefully to launch the week of the 13th. A physician order will be required. So it's not something where someone can walk in and get tested just just walking in. But if they have a test order from a physician, they will be able to call and schedule an appointment and then be able to get tested. So more information about that will be posted in the near future when we have all the details, and our physicians are all aware of it as well, because this is new information we're just starting to share today. But we're excited to be able to offer that. In the meantime, any person who comes to the emergency department, if the clinician determines they may be a candidate or may be at risk of having COVID-19 and they meet the CDC criteria, we are collecting a sample and providing it to the county laboratory for testing. And they continue to be really great about having fast turnaround times of 24 hours, which has been really helpful for us. So that is still our process. If a person doesn't meet testing criteria, we send to LabCorp, and then the turnaround time has been about under 72 hours, which is still pretty good. And that will continue. I also want to remind everyone, if you're having a medical emergency, call 911, go to your nearest emergency room. There are still people having other medical issues during this time, and we want to make sure they're still getting the care they need. I know it can be a little scary to go to the hospital right now, knowing what's happening, but if you have a true medical emergency, you still should consider going to the hospital. It's important for you to be cared for. And the last thing I'll say is I want to thank everyone who has been supportive of the hospital. We've received so many different showings of support and signs from the high schoolers and donations from so many different organizations. We really, really appreciate it. And I am so grateful to our doctors, our hospital team, our clinicians. They've been working very hard for the last couple of weeks, and I'm so grateful for their efforts. And I'm really proud to be a part of the hospital. So thank you. And with that, I'll pass it on to Dr. Joseph and
And what I'd like you to do, because you recommended that Dr. Joseph speak to us, could you do his introduction for us, please, and give us some background on why you chose him?
Oh gosh, it's hard to even start to explain, but Dr. Joseph is a preeminent expert in infectious diseases, and he had experience with the AIDS epidemic and has really been involved with the World Health Organization and is an expert with every national organization that has to do with infectious disease prevention and control. He's locally a great resource, and he educates our medical staff on how they can be approaching this in a very methodical way. And he's just an invaluable resource for everybody in our community. So we're really grateful to have him, and he's a leader at our hospital for sure. So I'll pass it off to him.
Dr. Joseph, welcome.
Well, thank you, Mayor, and Ann, thank you very much for the nice comments. I'm going to limit my time as advised and address two topics. One is a little bit about the virus and how we got where we are today, and then a little bit about preventing spread. And then after that, we'll leave it up to you how you'd like to do it, Mr. Mayor. So an epidemic requires at least the big three components. There has to be the introduction of an infectious agent, and for us, that's the coronavirus. It has to be introduced into a population that is susceptible, meaning that there's no natural immunity to it. And then third, it has to be something that is spread very easily between people. And the coronavirus too, it hit that perfect storm. That's exactly what we got. The agent was a coronavirus. It was a bat virus, and it's assumed that essentially none of us have a natural immunity to it or have ever been exposed to it. Thirdly, since it's a new virus and we're all susceptible, it is spread so easily. It's spread by the respiratory route, usually by exhaling an aerosol or exhaling breath that has some living virus into it that is inhaled by someone else who is close, or by touching a surface with a living virus on it and then touching your face. It doesn't go through the hands. It doesn't go through the skin. It doesn't go through clothes. You have to touch your face. This virus only lives in the respiratory tract. So I've had an opportunity for 40 minutes to watch all of you. None of you have touched your face today. And I want you to know I'm very proud of each of you for not doing that. So now to stop this, the age-old way of stopping this is quarantine. And it goes back centuries. And it really, really works, especially in small areas where the population is not very dense and you can keep people away from each other. The virus will just go away. However, that doesn't work with our modern society. There are practical limitations, and we cannot quarantine everyone the way it was done in the 1800s. So we have to have some modifications. Some of us who are essential to the workforce have to leave the house, can't stay at home. And we have implemented a couple of things through excellent education from all of you and many national agencies. Social distancing, this 2 meter distance or 6 feet meter. In the outside, it's extremely unlikely that a virus will transfer from one person to another if they're 6 feet apart. Keeping your hands away from your face, as I mentioned earlier, superb education on people doing that in amazing numbers of how many times people touch their face when they don't think about it. And the last thing I'm going to talk about is masks. So masks are of two basic kinds. There's one that filters what goes out of your mouth and one that filters what you breathe in. What goes out of your mouth is the standard paper surgical masks that's used in hospitals to protect patients during procedures. If they have an open wound or a surgeon is doing a procedure, we don't want the bacteria that normally live in the nose and throat to go into an open wound. That's an exhalation filter. Then there's the inhalation filter, and it's a completely different design. That's the N95. And that's designed to protect the caregiver when they're very close to a patient, when they have to do a procedure on someone who is infected with coronavirus, with tuberculosis, measles, or chickenpox. That protects the caregiver. What we're talking about now is the first one, the exhalation filter. Because we know now that there are so many people who are spreading this virus who don't have symptoms, that we want them to catch the aerosol that comes out of their nose and throat before it can be inhaled by someone else. A very simple principle. If the paper surgeon's masks become available, they're excellent. Right now, we're saving those for the professionals and the healthcare personnel. So what has happened is a tremendously novel way of creating a substitute for the surgeon's mask. And they're all over the website, as was mentioned earlier, and some of them are very cute. But I can tell you what we know so far, and that is the best exhalation filter is probably quilter's cotton, something that I absolutely have never heard of in my life. But it's extremely dense cotton, and it captures all of the moisture and the viruses that are attached to the moisture on the exhalation. Other things that are shown to be very good is 600 thread count sheets. And I have no idea what that is either, but I suspect they're very expensive. And if they're doubled over, that is superb. And then there's many, many other things. But there is a rule of thumb that is good. If you can shine a bright light through it and it looks bright, that's not filtering anything. So the websites that are out there are very good, and several layers of folded cotton is just fine. And even the CDC now has a website on how to make that. So in closing, let me just say this. I have to go out of the house to take care of patients, and I have to drive down the road. And I hope that when I'm driving down through San Ramon, I see everybody on the sidewalk wearing a mask. That would just make my day. It's a new thing. We've never, ever done it before in my 40-year history of infectious diseases. So I'm really looking to see that, and it will work. And lastly, I hear on television things that make me feel good inside, and that is several organizations, several persons paying tribute to healthcare workers on the front lines. And for that, we are all grateful, don't get me wrong, but it's more than that. It's not just the healthcare workers. I think we need more recognition of people like yourself who are making our communities satisfactory for people to stay in business, to stay in work, looking at how we're going to educate the people, looking at how we're going to get our economy back. So all of you also need the same amount of recognition as everybody else. This is not just healthcare people. So thank you for the invitation, Mr. Mayor. It was a pleasure to be here and listen to all of you talk.
Well, it's nice to have you as a resource, hopefully going forward. So Steve, I imagine we have a chance for some questions here. I'm going to let you quarterback that, please.
Great, thank you. As a reminder, if you email info@sanramon.ca.gov, we can get to your questions. If we don't get to it during this broadcast, we will respond as soon as we receive the questions. A couple items that I wanted to note, Mayor. On the city's website, we do have links to all the county sites that were mentioned today, the school district sites, San Ramon Regional Medical Center, and also Senator Glazer's site as well. So if you want to go for a one-stop shop to click anywhere, please go to the city website. Also, the San Ramon Farmers Market is open. They were open last week. They will be open tomorrow, according to their Facebook page. They're also taking safety measures at the farmers market. And next week, they're hoping to launch curbside pickup and order and pay online. So you can order your produce and pull up and have it dropped off right in your car without having to get out. So I wanted to make sure that that was mentioned as well. So going to the questions, let's see, a lot of them have already been answered through the comments made, but one here is on last week's virtual mayor's breakfast, the fire chief stated that they have testing and PPE for firefighters, but I wanted to check in and see what the status was for our police officers.
Well, and I can, I see Joe can talk about, I was just going to say the county does have a site for all first responders, medical professionals, fire, police. If they're not able to get immediately tested by their own agency or care providers, they can call in, get approved, go right in, drive through and get tested immediately.
Thank you. So actually, Stephen, if you'd like to bring Chief Stevens into the conversation real quickly, he is available to answer that question as he's coming online.
Yep, and there will be another question I think that the chief will field once he's on. There he is.
You're on mute.
Good morning.
Good morning.
As far as PPEs go, I can say that yes, we're very well stocked in the San Ramon Police Department. We are monitoring our burn rates on a weekly basis to, trying to project out the amount of time that we know we have inventory for. So right now, I think we're pretty good. We're in consistent communication with county health, and I know they're notifying us when other PPEs are coming in, and they're certainly disseminating those to municipalities throughout the county. But at this point, the city of San Ramon, we're very well inventoried when it comes to gloves, masks, isolation gowns, Tyvek suits. So I feel very comfortable where we're at as far as our PPE equipment goes right now.
Great. Steve, you had a follow-up question for the chief?
Yeah, he may be able to address this one as well. And this is a question that we received before with the new mask order. And not everything can be thought of ahead of time for these orders. So most banks prohibit entering with a mask. Should we wear cloth face coverings there or remove them?
Well, if you'd asked me this question probably 2 months ago, I probably would have told you that yes, under no circumstances should you ever wear a mask going into a bank. That's usually an indication that something bad's about to happen. And I still don't know if it's a great idea, but I think everybody is very much concerned about their health and preventing the spread of this virus. I think my first recommendation would be to try to do your banking remotely if you can. And if you need to go to your local branch, it probably would be prudent to reach out to the branch directly and let them know that you're coming in, maybe provide your clothing and physical description. If you're planning on wearing a mask, at the very least, it might soothe their anxiety when they see you coming through the front door wearing a mask. So I think my first advice would be try to do banking remotely, but if you need to go into to a bank, maybe try to at least give them a heads up that you're planning on coming in wearing a mask.
Thank you, Chief.
Great. There's a lot of questions related to masks, in particular, again, because of the new order. Some of them, I'll try to summarize a lot of them, but one of them is, now that cloth face coverings are recommended, where should I wear one? Is it necessary if I'm going for a walk or run outside and I'm keeping 6 feet of distance from others, or just in closed spaces like grocery stores? There's also questions about, as people are walking and there are runners running by them and not respecting the 6 feet of social distancing, what's the risk there of somebody running by someone on a walk that's not wearing a mask?
Dr. Joseph.
Yeah, I'm happy to address that. I don't want to overstep whatever guidelines or mandates that the city or the county has put out. But I have two comments. The first about the bank. One of the things that occurred at a branch that I went into where I was wearing face covering was that they asked me to take off the face covering, look in the camera, and then put it back on before I got close to the teller. At least then they had an image of me. Right now, I suspect that the guidelines are going to be wear face covering anytime it is likely that you come close to another person. If you're taking a walk in a rural area, taking a walk where it's unlikely to see anybody, it is not necessary to wear a mask. If you're walking down and you see that it's likely that people are going to be coming, then you should put that mask on your face. It is spread person to person, and it does require close distance to do it.
Great, thank you.
All right, another question, and this one I believe is for the state senator. Who will be in charge of restarting the economy? For example, is it possible to open some professions like hairdressers? And what standards would be required to do that, and what would it look like?
Well, such a good question. You know, the public health is governed by our public health officers at the county level and the state level, and of course the national level. And so none of us in leadership are going to do much on that important issue without their okay. So they're going to decide whether we've done enough to stem the exposure to this virus that endangers so many of us. And then based on what they do and the guidance that they provide, we'll begin to provide the opportunity to restart our economy and to have those types of activities come back. We did get a briefing this week about our economy and how easily it is going to be for these different segments of our economy to come back. It's not going to surprise you that one place that is going to be on the tip of the spear is going to be our grooming world out there, the hairdressers and barbershops and the like. So I'm encouraged by that, but it really is going to be the public health officers who are going to decide at what point do we expand our interactions and under what conditions. And then within each of these spaces, whether it's the barbershop or whether it's a restaurant or a bar, whether or not they can comply with it, that allows them to get their economic circumstance back in place and have people getting jobs again, matching that up with the public health requirements. That's really going to be the road that will travel going forward.
All right, and another question, perhaps for the state senator as well. How do we capitalize on this current situation to make sure that we're prepared for the next pandemic at the state level? And how can we shore up our public health infrastructure for years to come?
Yeah, so it all comes down to testing. We have to know what exposure there is in our community, whether it's on this virus or any other, in order for our public health officers to make good choices and good recommendations for how we can protect each other going forward. And I do think that's been a significant breakdown in our state and in our country. And I think our leaders know it. Certainly the governor has spoken about it many times, almost every day, about the importance of testing. So, and how new technologies are coming into play in order to have a better testing system. So I think that a part of that path to the future is going to be a more robust testing system with rapid turnaround, with widespread data, so our public health officers can make good choices.
Great, and also that could apply to the county level as well. I don't know if Supervisor Andersen would like to address, how are we preparing for the future?
Yeah, and that's something on my briefing call this morning, I was having that discussion saying because our public health directors within the Bay Area have been the ones who have jointly come up with orders. And what I've been asking is, do you have an economist in the room? Do you have a business person in the room who can say, if you just tweak that order a teeny bit, we can keep this whole segment of the population, excuse me, employed. And right now, because we've been in crisis mode, it's really been our health director saying we're focusing on the health of the community, and that is our priority. But for recovery, we are going to need to have those very bold discussions of, can we tweak it? Can we keep people safe? And so our health officers are getting that message from us as the electeds, and we've got to find that appropriate balance.
Great, thank you. I do have a question. It's also directed to the city, but our school board members might want to chime in as well. Would the city be able to help support celebrating our graduating seniors, maybe showing their names on the city marquee or allowing banners to be placed around the city? Has there been any thought as to what we can do to help the seniors celebrate graduating this year while in a shelter-in-place order?
Well, from a city perspective, we definitely would, not only from a personal perspective of having a senior right now who is pretty not a very happy camper regarding this. He understands what's going on, but it's very, very disappointing. If you remember back in your senior year and your graduation, it's just an amazing time usually, and a transition, the next chapter of your life. And so it's very difficult. So the city would certainly participate and partner with the school district, which we do always anyway, to involve ourselves in any way we can promote these kids in a safe way. So I'm sure we'd be happy to do so.
Ken and
Just from
Rachel.
yeah, sure. Just from the school district perspective, first, I'd like to just say to our community that the San Ramon Valley is a very unique place where our agencies, Town of Danville, City of San Ramon, School District, Fire District, the county, are constantly working together, collaborating to make sure that we provide the best possible services to our community. And I really appreciate that partnership. As far as the seniors and graduation, Superintendent Schmitt mentioned this during his remarks. We're doing everything we can right now, working in fact with other school districts to look at different alternatives that we'll be able to celebrate with these students in some fashion. Not quite sure what that looks like yet, but there's a lot of work going into that. In fact, we're going to be talking more about that, I think, in one of our sessions coming up with the school board. We've been hearing from our students, and as city manager mentioned, yes, they're very frustrated and disappointed with the current situation. But our hope is that everyone does fully understand the kind of situation we're in. My own daughter was born on September 11th, and on 2001, it was her Sweet 16, and faced very much the same situation of, one of those rites of passages that had to get put off for a while. And our hope is that it's not something that's going to be canceled, but postponed in some way, in finding the right kind of celebration for those students and their families and friends.
Rachel, any thoughts?
I just want to chime in. I want to assure people we're going to acknowledge this important rite of passage. We don't know how yet. There's time to figure it out. There's about 6 weeks. If we're all sheltering in place longer, maybe it gets extended longer, but I mean, the opportunity to celebrate the achievement. We haven't had a chance to talk about it. The board hasn't even gotten to weigh in at all. I sent a text to the superintendent. It is on our closed session agenda for Tuesday. We're not going to let this go unnoticed. And I think it was unfortunate that in the communication about it, we used the word cancellation. We could have said postponed/cancellation, something like that. But as Rick said, they put out dozens of communications, and sometimes no matter how carefully you look at every single word, you talk yourself into, oh, we address that in the next paragraph, but people react to the word. And I think that that's unfortunate. I think everyone feels badly about that. It should have said postponed and rescheduled in some fashion or something. We're not going to let it just go. And as Rick had mentioned, we're going to involve students and parents, an opportunity to give input in that too. So I don't want to, be flippant. We've got this, but I want to assure people we're going to do something, and especially assure our students we're not going to let your achievement go unnoticed.
Thank you, Rachel. Thank you, Ken. Those are very reassuring words. Thank you. Steve, how are we doing on questions?
We have a couple more, and I think we have time for both here. The next one, as a resident of San Ramon, I'm genuinely worried that the county health department has not mandated that grocery workers test themselves for COVID-19. Isn't it logical that this requirement is imposed on such high-touch personnel?
I'm guessing that's to me.
Yeah.
If we had enough test kits, we would be testing everyone. And again, right now, we are having every grocery store follow extremely safe precautions. And we are having you as the customer also follow extreme precautions. And the reality is we don't have the number of test kits available to test every grocery worker. And we have a priority, Rossmore, people working in Rossmore, working with a higher risk population, all of those things. Ideally, in a perfect world, we would have more test kits and we would be taking our temperature every time we stepped out of the house and anytime we walked into public, and we would be able to do some rapid tests to see quickly whether someone has it or not. But the reality is we do not have those, and we do have precautions. So if you're feeling ill, you're feeling symptoms, stay home, but also cleaning surfaces, wearing gloves, wearing masks, all of those things is kind of the best we have right now. And until we get more test kits available, both in Contra Costa County, the state of California, the United States, we're kind of stuck with what we have. And so that's where it's incumbent on each of us to exercise caution. And when you get home, don't touch your face after you get back from the grocery store, and wash everything down, use wipes, whatever you need to do to ensure that whatever is being handed to you is still going to be safe. So it's a challenge, and I wish we had the test kits to do it.
For Dr. Joseph, give you a chance to unmute. With all those protocols in place at stores, people wearing their masks appropriately, in your professional opinion, do you feel as if that's a fairly safe environment for people?
I do. The testing is a real enigma. If we went into any of our large supermarkets or grocery stores and we had the test kits that Supervisor Andersen was talking about, and we tested everybody and they were negative, they could be positive tomorrow. So this test only tells you if you're carrying the virus at the time you're being tested. This is not a test, although we have those, this is not a test to tell if you've been infected 2 weeks ago. It only records the virus that is present at that time. So to the person who questioned testing everybody in the supermarket, it would be a false sense of wellness because they could be infected the next day, and obviously impractical to test everybody every day. On that line, there is an antibody test that has been developed that looks very good to me, that tells if you have been infected, and that will be rolled out in the next couple of weeks. Now, that said, the exhalation mask, if one is wearing a good exhalation mask, all you have to do is capture the moisture. If you capture the moisture, no virus goes past it. So if the mask is dry, it's working. If it's a good mask, not something that you can see through. If it's several layers of cotton and you just take it off and put on another one if it gets moist or uncomfortable. Washing it in soap and water or laundry detergent, it's all that's necessary. So yes, I do feel safe going into a supermarket where the persons are wearing a mask and using social distancing as much as practical inside a store.
Great, thank you, Doctor. Steve, you have a last question for us all?
Sure. Last question. Several of my neighbors don't want to stay at home and even argue on social media that they don't need to shelter in place. What can you say to convince them that their role and need to sacrifice in this pandemic for the greater good?
Somebody want to tackle that one off the bat? I think one of the most important things we do as community members is that we work together. and that none of us should be the exception to the rule. And we're only as strong a community as the weakest link. And that a part of the strength in our community is that everybody abides by the social norms of social distancing, and nobody is above the rules and above the law. Any other comments?
Yeah, I have one comment. I have several patients for whom I have cared that have acquired COVID from a person without symptoms. And we know that because 48 hours later, the person that they were having a conversation with across the desk got sick. For those people who don't want to stay at home and don't want to respect the guidelines, they may be shedding virus, or they may acquire the virus from someone else and spread it to someone who could die. So following these guidelines is reducing the death rate. Following these guidelines is stopping the transmission of virus from persons who have no symptoms. And that's the main purpose of the masks, the guidelines, the quarantines. It's this asymptomatic spread that has caused the problem.
Any comments from anybody else before we draw this to a close?
Well, Mayor, I would add one factual point and then an opinion to that issue. The factual point is that almost half of those who have been admitted to hospitals are under the age of 50. So the idea that somehow this is an old person's illness is not true. It is true that those who are older or have pre-existing conditions, and the doctor can speak to this, are much more vulnerable to serious consequences and death. That's the facts. The opinion is that I think about it, it's like I'm trying to protect my mom, my aunt, my grandmother, that those who are most vulnerable are the ones that my behavior affects. It's not just about me. It is about my neighbors and my community, and in particular, our elderly. And that definition of elderly may surprise you. I don't feel like I am, but I'm somehow in that category. Put that aside.
Yes.
So a factual issue, which is that we're all vulnerable, not just the old, for serious illness. And number two, that really at the heart of it is we're trying to protect everyone. And that means we need to do what is required of us to protect them. And that means wearing a mask.
Great. Last call for any comments? But I want to thank everybody who participated, especially our special guest, Dr. Patrick Joseph. We appreciate your comments. Senator Glazer, thank you for stepping on and being a part of this. And for those who've been here before, Candace, thank you for your work with the county. Joe, we appreciate everything that your staff is doing. And Chief Stevens, of course, we appreciate how you keep us safe. School board members, you guys got a lot of challenging times. Next week, we go with distance learning. We are all very supportive, and let us know how we can be of help going forward, okay? And of course, the master of ceremonies who put this all together, Stephen, thank you for coordinating all this. You guys have a great week. Next week, tentatively, we have Stanford Health involved. Next week, we may have some people from the grocery chain. Again, Stephen Glazer, we appreciate your comments. We're going to check in with them too. And then Assemblywoman Rebecca Bauer-Kahn also is tentatively scheduled too. So, and if Candace can make it back again to give us a quick update, that would be great. Thank you, Candace. All right. You guys have a great day. Stay safe. Take care. Bye-bye.
Thank you.